Andy will be right here.
Meeting of the committee will please come to order. In February, President Obama called upon the Congress to enact legislation to reform America's health care system. In April, Governor Kathleen Sebelius was sworn in as Secretary of Health and Human Services. Her department has the lead responsibility for improving the health of the American people. Last Friday, I joined with Chairman Rangel and Chairman Miller and Chairman Emeritus Dingell to propose a discussion draft on health reform. This morning, we have the honor of hearing Secretary Sebelius present the administration's views on the discussion draft. Based on her contributions today and on what we will hear and learn from the 50 stakeholders appearing before the Health Subcommittee this week, and on the input from the members, we will revise the discussion draft and introduce a bill for consideration by the three committees. Our legislation will reduce health care costs. It will cover all Americans. It will improve the quality of care, and it will be fully paid for. The lead sponsor, the lead author, will be John Dingell, Chairman Emeritus of this committee, who has faithfully carried on his father's legacy as an undisputed leader in the struggle for health reform. I want to emphasize a few important points about the discussion draft. First, it is just that, a draft for legislation, for discussion for the legislation. We are seeking input from the administration and others because we want to improve the draft before introducing legislation. Second, the draft builds on what works in our uniquely American system. It builds on the employer-based system for providing health coverage to workers and their dependents. It relies on and improves Medicare as the source of health coverage for the elderly and the disabled. It builds upon Medicaid to extend coverage to low-income Americans. Third, the draft fixes what is broken. It fixes the broken individual health insurance market by creating a new insurance exchange through which uninsured Americans can enroll in their choice of health care plan. Those who cannot afford to purchase the coverage available in the exchange will receive assistance. A public option will be available within the insurance exchange to give consumers an alternative to private health insurers for their health care coverage. This public option will be self-supporting, will not receive ongoing subsidies from the federal government. The public option will compete. No one is obligated to sign up for the public option. No provider is obligated to provide medical services under the public option, but the public option will provide competition so that we can make the market work and keep everybody honest. The draft contains provisions to reduce rural, racial, and ethnic disparities in disease incident and treatment. The draft fixes the broken Medicare physician payment system and prevents the irrational cuts that are scheduled under current law from going into effect. The draft takes the steps necessary to fix the shortage of primary care practitioners and nurses and other providers. And finally, the draft ensures that people have a choice of doctors, choice of benefits packages, and choice among insurance plans. This approach builds on what works and fixes what's broken and makes sure that people have choices. It's pragmatic, and it will produce the results the nation's healthcare system so desperately needs: lower costs, broader coverage, and better quality. Today, we'll continue on a journey that began over 100 years ago to provide health insurance for all Americans. Some of our greatest presidents of the 20th century, Teddy Roosevelt, Franklin Roosevelt, and Harry Truman, were advocates for health insurance for all Americans. President Clinton fought hard for his administration's proposal. Those initiatives may have failed, but the hope that inspired them was never defeated. The time has finally come to redeem that hope and to deliver true health reform. In my conversations with colleagues and constituents, I'm getting the clear sense that there is now a willingness to tackle this issue and to resolve the problems and bring forward a much better health care system for all Americans. With President Obama in the White House, we now have the best opportunity ever to enact health reform. I'm determined that we not let this opportunity slip from our grasp. I look forward to this morning's testimony and continue with urgent pragmatism to send health reform legislation to the President for his signature this year. I want to recognize, for an opening statement, the ranking Republican member of the committee, Mr. Barton.
Well, excuse me. Thank you, Mr. Chairman. You and I earlier this year attended the several White House health care summits. At those summits, both in the large meetings and in the working group meetings, I said that the Republicans in the House and the Republicans on this committee were very ready and very willing to work with the President, with you and Mr. Pallone and other members of the majority to create a new health care system for America. There's no member of Congress on either side of the aisle that's opposed to improvements and reforms in our current health care system. So we were ready to work. You told me repeatedly that you were ready to work with myself and the other Republicans. Having said that, actions speak louder than words. While you and I have held several meetings, personal meetings, and we held one meeting with Chairman Pallone and Ranking Member Deal of the subcommittee, we agreed to work together. The brown bag lunch that was supposed to occur because of that was scheduled and rescheduled. And finally, last week, we were supposed to have had it last Friday at noon, and we were called the afternoon before and said that that brown bag lunch on a bipartisan basis could not be scheduled because you were attending a press conference to unveil the Democratic health care bill. That's not bipartisanship. That's not inclusiveness. It sure made me feel like the young woman who was being wooed by a young man, and the young man kept promising to take her out on a date, and he finally called her up and said, well, I know we had a date tomorrow, but I can't do it because I'm getting married to somebody else. I guess there's some people that do both, but luckily you're not one of them, and I'm not either. But it is what it is. So we now have a bill. We've got the Secretary of Health and Human Services here to probably wax eloquent in support of your bill. I haven't read her testimony, but I bet it's going to be supportive. The good news is we're going to have a series of hearings, and we will at some point in time go to markup. Hope springs eternal on our side that some of our ideas may yet be included. The bill in its current form, I have not read all 852 pages of it. I'm not going to fib about that, but I've seen summaries, and it's a massive government involvement in Americans' health care. It's hugely expensive. I've seen estimates as high as $3 trillion over 10 years. I'm told that the word shall is mentioned over 1,300 times. I'm told that there are 38 new mandates, that there are dozens of new bureaucracies. I listened to your opening statement, Mr. Chairman, and heard you say that nobody has to take the government plan who doesn't want it. That may well be true technically, but if you put so many mandates on private insurance that it becomes cost prohibitive, and if you raise the Medicaid eligibility to 400%, there are going to be millions of Americans that lose their coverage because the private businesses that offer it can't afford it, and then there are going to be millions of Americans who say, why should I pay a monthly premium of X dollars when I can go on Medicaid and pay little or nothing? You know, the short of it is that if your bill were to become law, we wouldn't have much of a private health care system in America within 10 to 20 years. So, putting me down as undecided, Mr. Chairman. We will work with you. We have a number of amendments. We have a Republican alternative that's private sector based, lets the individuals maintain their choice. We do some of the things that you do in your bill. We do have a permanent physician reimbursement fix. We do have a tax credit, reimbursable tax credit for low-income Americans. But the big difference between the Republican bill and the Democratic proposal is that on the Republican side, we still believe in the marketplace. We don't have all the mandates. We don't force Americans into a government plan that we think is not very good for America. With that, Mr. Chairman, I'll submit the rest of my statement for the record and look forward to these hearings.
Thank you, Mr. Barton, and I am sincere in saying I want to work with you and share a brown bag lunch with you. Thank you.
Now you've got your bill.
I want to, and this bill is a draft, I want to recognize Mr. Dingell, the Chairman Emeritus of this committee, the champion of health care reform, and the man who will be the first name on the legislation that will produce health care reform. Mr. Dingell?
Mr. Chairman, first, thank you for holding this important hearing, and thank you for your remarkable leadership on moving forward towards the resolution of the health care problems we have in this country. I want you to know that I'm grateful and proud, and I'm particularly appreciative of the kind words you said about my dad. And on behalf of my dad and I want to thank you for your kind words and thank you for your friendship. I also want to do something of a personal character here, and that is to welcome Secretary Sebelius to the committee. Your father was a valuable member of this committee and sat in this room for a number of years, and we were always proud to have him here. And your father-in-law was a valuable member of the House, as you will recall, and was a man who was much respected. So your coming is like coming home, and we hope you feel that way, Madam Secretary. This week marks the beginning of a truly historic process, an opportunity to fulfill our moral and economic obligations to provide quality, affordable health care coverage for all Americans. The current system is not working. When my dad started on this years ago, it was a matter of humanitarian concern. Americans were dying for want of health care, and health care was not available to most Americans. Today, that still is true to one degree or another, but it is now an economic necessity, something which must be done to enable the United States to continue to compete in the world marketplace. And our industries are being killed by the lack of this kind of support in a fiercely competitive world economy. 47 million Americans are currently without health care, and upwards of 86 million will be without health care at some point during this year. More and more Americans are being forced to make decisions that they never should be forced to make. Do they pay their monthly health insurance premium if they can get a health insurance policy? Or do they pay the utility bills, the mortgage, or do they buy food for the family? American business owners are facing a tough decision as to whether to meet the monthly payroll or to pay health insurance contributions for their employees. And if you look at an American automobile, it's got $750 worth of steel in it and $1,600 worth of health care. Foreign competitors don't confront that problem. The federal budget can no longer sustain our current health care spending. If health care costs grow unabated, the costs to the country will be more than 20% of its gross domestic product on health by 2018. The discussion draft, and I stress the words discussion draft, we're considering is a uniquely American solution to this crisis. It's been a privilege for me to work with you, Mr. Chairman, with Chairman Rangel and Chairman Miller on putting this draft together. And I want to commend all of those, including the subcommittee chairman of the three committees, who have worked so hard to bring about unprecedented coordination that went into producing this single discussion draft for the 3 committees of jurisdiction. Now, I want to make some things clear. The discussion draft will not create a single-payer system. It will not ration care. It will not attempt to destroy the private market system or the system of employer-sponsored health care many Americans enjoy today. And anybody who says otherwise simply hasn't read the bill or is not being truthful either with himself or anybody else. That being said, each of us in this room has our own vision of what ideal health care reform looks like. While the specifics may be different, we all share some common goals. First, we must pass legislation that reduces the cost of health care for families, businesses, and government. Second, we must pass legislation that makes quality, affordable health care available to all Americans. And we must pay for this legislation, and we must pass the legislation now. The choices we make over the coming months are going to be historically significant, and they will rank with the passage of Social Security and Medicare. If we are courageous and enact comprehensive health care reform, our product will meet the tests of history. And I would note, will rank, as I mentioned, with Medicare and with Social Security. Medicare was mentioned on the editorial page on Sunday of the New York Times, is only short of the flag in its popularity. If we are not courageous, we will have failed this generation and generations to come, and the country will suffer for it. I am certain this year we will pass comprehensive health care reform that will build on the existing system, keep intact that which is working in our system, and give people the peace of mind that no matter what life changes they face, they will always have access to health insurance. The American people deserve nothing less. Thank you, Mr. Chairman.
Thank you very much, Mr. Dingell. I now want to recognize Mr. Deal. Mr. Pallone, as the chairman of the subcommittee, gave his opening statement yesterday. Mr. Deal did not have that opportunity. And I want, by unanimous consent, that all members have an opportunity to submit a written statement, opening statement for the record. Mr. Deal for the last opening statement.
Thank you, Mr. Chairman, and thank you for holding this hearing, a series of panels today and tomorrow. I want to welcome all of the witnesses who are joining us, especially express my appreciation and welcome to Dr. Todd Williamson, who's the president of the Georgia Medical Association. Certainly, as we consider this draft this week, hearing from these witnesses is important. Mr. Chairman, I think we've reached consensus that appropriate reforms are necessary, but we differ with respect to the right methods of reform, which will yield cost and higher quality savings, and the decisions that should be left to doctors and patients and not federal bureaucrats as they make choices about health care for our people. More government, in my opinion, is simply not the answer, but the draft before us seems to think that that is the answer. As far as the Republican views are concerned, we have seen thus far an attempt to approach health care reform in a bipartisan fashion has resulted in what we consider to be a partisan proposal, which refuses to address the concerns of members on our side of the aisle. Last Friday, we received an 852-page reform draft. That's merely one legislative day before the committee began its hearings. We are concerned about the cost. Congressional Budget Office has yet to weigh in on those costs. Early analysis by Mr. Steve Parente, who testified before our Health Subcommittee yesterday, scores the legislation at a whopping $3.5 trillion over the next decade. We need to come up with real solutions to improve health care that American families can afford. The promise of the Obama administration and the leadership here on the Hill has been that if you like what you have, then you can keep it. I believe that's simply a play on words, because if this draft does what I think it will do, it will destroy that private health insurance market and will ultimately lead to what I consider a one-size-fits-all government plan. If we focus on reforming the healthcare delivery system with the benefit of the American people in mind, then we should not focus our efforts on things that will destroy the private insurance market. I believe we should be encouraging physicians to enter into the field of medicine as the demand for healthcare related services will continue to grow. But with the proposal before us today, which benchmarks public plan reimbursements to Medicare, that in itself continues to drive providers out of the system. And I believe we will fall short of the objective that all of us share of having a system that encourages doctors to enter, it promotes physician-patient-driven decisions, and allows everyone to gain access to health care coverage. Mr. Chairman, we all agree that changes to our health care delivery system have the potential to yield significant savings and improvements in the efficiency of delivery of care, but we must ensure that reforms that we put into place promote competition and transparency. As we move forward, I hope we will get that CBO score. I think it's important to the deliberations that lie before us. And, Mr. Chairman, I want to reiterate again that those of us on our side of the aisle look forward to being able to work in a bipartisan fashion as we consider the potential for amendments that will obviously be suggested. Thanks again to our witness, our Secretary, and thanks to all the witnesses who will make up the panels that will follow. With that, I yield back.
Thank you very much, Mr. Deal.